Hello everyone, my name is Elias Silva. I am a student from BSU Imaging Program and I'm filming from the Diagnostic Imaging Department at my facility. And today I'm here to talk about the needs assessment that we can perform in our departments, and the necessities and the findings that we can have when we do a needs assessment for our department. Now, to identify some properties that, or important issues that we found in our department by doing this assessment, was one of them was like was low trust, and low trust between management and the staff. And priority, we found that during the assessment the priorities weren't being met for the department, and the systems were not functioning as they should, as they were designed to function. And so there were low trust. The trust wasn't between mutuals, and so that was a struggle that we assessed and we found. Another thing that we found was there was no really strategic planning for the needs of the workflow with when patients were coming in, coming out, and when it creates like a bottleneck when patients come in, and employees are stressed and overwhelmed in regards to the patient flow. Manager wasn't attending to any of those issues, but at the same time, the staff wasn't informing or educating the management of the issues or the problems. So there was a miscommunication there too. But luckily, we found out during the assessment. Another thing could be a poor alignment. Poor alignment is what we found in our department, which the values were not shared. The values of the management team and the values of the department, and they were not shared. They were not, in alignment. Okay, there was no structure. There was no structure within the departments, and therefore there was a lack of culture. There was no culture building or anything that would work and function well for a hospital department. So there was a struggle there, but with these assessments, you can find these opportunities and build on them and make progress. Once you identify the problems or the opportunities, there's only a road to success. There's the department. In the departments, you find the opportunities that will promote progress to move forward, to continue. Doing a better job for the staff, and of course for the patients are affected all the time. The customer experience is always affected when you do an assessment and you find something that wasn't working well but now is. That impacts our patients too. One thing that our department did was education. They thrived on education and training. For training on building strategies on how to improve our flow, and to improve the communication. They worked on the workflow plans for the patients and for the department, which was a success. To the use of the resources in our department, like cross collaborating with other departments, not only other modalities but other departments, to the cross collaborating with ICU, with ER, with the emergency room, and finding out when they can bring patients in, so therefore not all patients come down at the same time. That was a big improvement. So cross collaborating definitely helped, and communicating and having management team be the leaders of this movement, where they would tell, okay, we got these many patients. We're going to bring these patients down from the 5th floor or from wherever, and that really contribute to a team building, or building up the trust from the staff to the management, and that was very successful also. The leadership team really got involved in things like that. So in building an assessment, a need assessment also contributes to sharing decision making, and contributing and allowing the staff and management both to contribute to any decisions that were made to improve the workflow and the needs of the department. That definitely always affects our patients at the end of the day. Okay, and so yeah, that's how productive it is to do a needs assessments for every department or wherever it is that you work. Thank you for watching this video and learning a little bit about needs assessments for the medical department. Thank you. Have yourself a wonderful day. Bye.